Hey guys, Amity here. I thought I'd just jump on and do a very quick educational video. I did put the call out on the Facebook page to ask what things you guys are interested in learning a little bit more about. So first up, I thought I'd do eyeliner tattooing, which was one of the first suggestions. So I know that I've discussed a lot about brow tattooing, and I do have a few videos on my YouTube channel and the website as well. And I'm sure if you go searching through the Instagram and Facebook, you'll find them there as well. But eyeliner tattooing is a little bit different. So there are a few points that I'm going to go through in this video, which you should know before you go into getting one done. Or if you've already had one done and maybe you're not happy with something and you're wondering why that happened, this video might help you with that as well. So first of all, what is cosmetic tattooing? So I've explained this before. Cosmetic tattooing is very different from body tattooing. So with body tattooing, typically the needle size is a lot bigger. We often use sort of shader needles with body work to get more of the ink in. The ink is completely different as well. It can have more ingredients in the ink, but it's also a bigger particle. And we also penetrate that ink in body work deeper into the dermis. So when we're thinking of the dermis, sort of you've got your papillary dermis up the top, just underneath your epidermis and your basoepidermal junction. Then you've got your papillary dermis, then you've got your reticular dermis. When we're thinking of body art, we're going deep down into that dermis and implanting larger molecules of ink so that they stay for longer. And your phagocytes that are in your skin are actually too small to eat away at most of that ink. So that's why we can get these amazing tattoos to last for quite a while. When we're talking about cosmetic tattooing, we're implanting the ink a lot more shallow than body ink, and it's a smaller particle size. So as our skin cells desquamate and come to the surface and slough off, ready for new, more youthful cells to come to the surface, it's going to take some of that ink with it. So anything that's sort of implanted in that real superficial epidermis is going to come off as sort of a scab, but it doesn't really scab the way that body ink does. So it's a little bit finer scabs, and a lot of people don't really notice it. It also, when we're putting the ink sort of at that basoepidermal junction or just above, it will eventually be sort of pushed to the surface and broken down a little bit. When we're implanting it at that dermoepidermal junction or in the top of the papillary dermis, it's going to stay there. However, our phagocytes can actually come and break that ink down a lot quicker. Because if you're thinking of sort of, you remember the old Pac-Man game, and the Pac-Man comes along and he's eating the balls or whatever they were. If you think of body tattoo ink as being this big and the Pac-Man being this big, but then you've got cosmetic ink which is this big and the Pac-Man being this big. So the phagocytes are able to come and break down that ink. So with cosmetic ink, especially with eyebrows, you'll see that the color can change as it fades. With eyeliner, so with eyebrows, it's typically like a pinky shade or an ashy hue. With eyeliner, it tends to go a little bit on the ashy to blue hue. Now, eyeliner tends to last a lot longer than brows do. So you can get up to say 5 years before you need a touch up. But just so that you know, when you go in for your tattoo for eyeliner, if you're requesting say a nice sharp black, say you do what I do and you draw on a black liquid. So that black liquid or gel eyeliner has that nice shiny wet look to it throughout the day. You cannot get that with cosmetic tattooing. So if that's something that you want, don't go and get your eyeliner tattooed. Just continue drawing it on, because once you've implanted the ink into the skin, you're going to have epidermal cells which are going to grow over top of that when it heals the wound. So when you've got those normal skin flesh toned epidermal cells over top, it has to tone down that cosmetic ink. So you'll come out and you may love your eyeliner for like a week. Just be prepared that it will fade, it will soften a bit. Now, one thing I really want to mention, which is something that's big in this industry, I don't know how many years ago it was, but it was at least about 4 years ago, it became illegal for anybody other than doctors and pharmacists to be able to give you numbing cream. So when you go into a tattoo parlor or cosmetic clinic to get your brows done, just be aware that they are not allowed to give you numbing cream. So if someone is giving you numbing cream, then you know that they're not actually doing the right thing. So just be aware of that. So I actually have certain numbing creams that I get made up for me. So they're compounded by a pharmacist you buy them directly from the pharmacist. You can discuss how to apply it and everything with them. I've got it all on written instructions, but it's your responsibility to make sure you have the numbing cream, you test patch yourself, and you are okay with using that numbing cream. Now, for eyeliner, I use a very specific numbing cream. So you can't just go and get one over the counter and think that it's going to be okay for your eyes, because you do run the risk of having eyeliner, the numbing cream getting into your eyes. Now, I do want to touch on the risks as well. So that is one of the risks. Now, typically, if you do get any of the numbing cream in your eyes, what will happen is one of two things predominantly. So one thing is your pupils can dilate. Now, if your pupils dilate, it's not necessarily dangerous, but it can mean that more light is getting into your eyes, which can make it difficult to drive. So this is a rare occurrence, but it can happen. So often with eyeliner, it can be beneficial to either bring someone to your appointment who can drive you to and from just in case. You might also swell from it as well. So having someone drive you can be handy as well. Or having someone just on hand. Or allowing time afterwards to relax at the salon. I can make you a tea or coffee or whatever while you're waiting for your eyes to calm down. The other risk is that you can get corneal abrasion. So, and this is also either due to the numbing cream getting into your eyes, which, as I said, can happen. So, for example, I've had 2 people get numbing cream in their eyes. When I do go through the process, I do a thorough consultation and I explain to everybody, do not open your eyes while I'm tattooing. And I say it a million times, people still open their eyes. They go to talk to me and they forget that I'm tattooing their eye and they look up at me. It's the same thing when I'm tattooing lips. I say to people, and you would think it's common knowledge, but it's not. I say to people, if I've got a needle in your lips, you cannot talk to me. And the amount of people, as I'm tattooing their lips, try and talk to me, and it moves their lips. So these things happen. It's just something that you don't really think of, and you're listening, but at the same time, you're so excited for your treatment. And I might say something like, often I'm talking about my dogs or something, and you might want to respond, and people will have their eyes closed and I'll be to the side and they'll go, oh yeah, I agree. So it's something that I constantly remind you of as well throughout the treatment, but you have to just be mindful. It can happen. And if it happens, the general things are, yep, you can get a little bit of stinging and stuff. I flush it with saline, but that's one of the risks. Now, another one of the risks is that you can get what we call blowout. Now, what I want to discuss here is firstly to explain why this happens or why this can happen. Now, I've never done it, but I've seen it a lot because I do a lot of fix-ups on people. And this is something that's very, very difficult to fix. So when you're in the mirror and you're doing your eyeliner, right? So for me, for example, my eyes, I feel like I need to bring them out further. So I sort of do a tiny little tick to the side, and then I thin it out on the inner because I like to put a little bit of glitter in the middle. It makes me look more awake, especially in lockdown when I'm going mad trying to do a million little things at once. Now, the other thing that you'll notice on me is that I don't do the lower eyeliner. Now, a lot of people do this. I personally don't. I have a larger head, and if I close in my eyes, it actually makes my eyes look smaller and they won't be balanced with my head size and shape. So for me personally, this is how I do my makeup basically every day, because it opens up my eyes and I think it's quite flattering on my face. So if you're someone who comes in and you say, oh, I'm getting my eyeliner done. So for me, I don't charge you extra if I'm doing the lower eyeliner. So people say, oh, well, I may as well get my money's worth and I'll do both. 9 times out of 10, you don't actually want to do that. So what happens is, now this is, if I was to tattoo this on my eye, this would be perfectly fine because I haven't actually touched the outer canthus or the inner canthus. So they're the very corners of your eyes. Now, the other thing that we cannot tattoo, and this is something that you guys have to understand, is your wet line. So when you're looking at sort of the top of your eye here, so just above your lower eyelashes, you can see the wet line. Now, when we tattoo or when we pencil on our own and we try and do a beautiful smoky eye, especially makeup artists, if you're following any of the amazing local artists, you'll see that they often will put some of the shadow or some of the eyeliner onto that wet line. And going out for an event or photography wise, it can look amazing. You can't tattoo that. So you cannot tattoo the inner or outer canthus and you cannot tattoo the wet line, which means if we were to do an upper or lower eyeliner, They can't join. So I can't do the upper eyeliner and then do the lower eyeliner and have them join at the corner. That can't happen, because then you get blowout or migration, which is where some of the ink will push to the side. Now I'll try and find a photo to include in this video. If I can't, I'll put one in the comments so that you can see. I'm just going to find one on Google to show you what I mean by blowout, but it's something that you absolutely don't want. So that's the first thing, is you cannot join the upper and the lower eyeliner. I'm looking at myself in the camera so that I can see where I'm pointing. So if my eyes are darting, that's why. Okay, so the other thing is the wet line. So we can't do the wet line. So if you're someone who you're watching this and you're saying, nope, I want to book in and I want to do upper and I want to do lower. And you're someone who draws on your eyeliner every day, for example. If you draw on your eyeliner every day, that's fantastic. Tomorrow when you wake up, I want you to try and draw your eyeliner on your lower eyeliner without touching the wet line. So you sort of put it in between the lashes, and then just to make sure it's tidy, grab a cotton tip. You can use it wet or dry, and just pull your eye out a little bit and use the cotton tip to just take any smudging off that wet line. Now keep in mind, so you don't want to have any eyeliner in the outer canthus and nothing on the wet line. Then wear that for a day and see if you're comfortable. Often we find that people don't have symmetrical eyes. So basically nobody that I know has symmetrical eyes. We all have one eye bigger than the other. The other thing is that your lower eyelid is actually not symmetrical. And as we age, they can droop a little bit. So when they droop, so you might be young and youthful and have amazing skin and beautiful eyes at the moment. If we tattoo them now, as you're aging, you have to keep in mind, what's that going to look like in 10, 20, 30 years time? So I've already explained that the color does change a little bit. So doing color boost sessions is going to keep it nice and black. But as I said, it's not going to be a strong wet look black. It's going to be more like if you put a pencil on rather than a liquid defined eyeliner. You can do different sort of shading effects and things like that as well. And you can get different wings. Now, you've got to also consider, again, how this is going to age. So if you're doing a wing, if you come to me firstly and you say that you want one of those racer wings, I'm instantly going to say no to you. I can technically do it. I refuse to do it because it will not look good in the future. So I don't know if anyone's ever noticed, we can get hooding where our upper eyelid sags. And now if you haven't really seen this before, next time you go to Woolies or Coles, just sort of have a look around and you'll see what I mean. As we age, our skin sags. It's something that unfortunately, as much as we fight it, it's going to happen anyway. We can try and stave it off as best as possible and keep our skin looking as good as possible, but be prepared for the worst case scenario just in case. So if you were to get one of these massive eyeliner, like you see the adverts online for Quick Flick, which is a stamp-on one, and all of the models, they've got 3 different ages in that ad, but if you'll notice, all 3 ages in that ad, none of them have hooded eyes. So even the older lady in that advert can use Quick Flick and she can have that because she doesn't have a hood. That is rare. Most people will have some sort of hooding. So doing a larger flick out the side is not recommended. So, I mean, you can even draw it on yourself if you want to, use a liquid eyeliner and then sort of pull the skin down and see what it's going to look like. But I don't recommend it. My sort of favorite thing to do is what I call a lash enhancement, which is where I'm putting the ink in between the lash line. This actually gives the appearance, it's a more natural look, but it also gives the appearance of a more thick and luscious and healthy eyelash. So if your eyelashes look thick and dark, it gives you the appearance of being more youthful and healthy as well. Then from there, we can build it. So so my sort of styling is around about the thickness that I like to do. So a little bit of a wing, and I sort of shape it to show or highlight the good things of your face rather than the bad. So if you're someone, for example, that has really, really close set eyes, you sort of want to bring it out a little bit. If you're someone who has eyes that are further apart, we can sort of make it a little bit heavier on the inside and a little bit softer on the outside. If you're someone who has really big eyes and you have a beautiful lower eyelid and you want to close them up a little bit, then yeah, we can do a lower eyeliner. You don't also have to have a full lower eyeliner. You can have a half or you can have a dotted. So it's where we sort of start, it's a little bit heavier at the ends, and we sort of flick it in a little bit so that as it goes towards the center, it fades off and gets softer. So typically you would never have as thick a lower eyeliner tattooed as you would an upper. So yeah, my advice is really think about whether you want upper and lower, and think about sort of the wing and how your face is going to age, as well as color. So I personally love doing black, but you can also do beautiful, I don't know if you can see the picture in the background, but I've done eyeliner in that color as well, and it's amazing depending on what color iris you have. All right, so I've spoken about results, I've spoken about how it fades and the color can change. Now when you're coming in for your treatment, you cannot have lash extensions on. If you come in, so if you book an appointment, I always do a consult with you. I will tell you not to have lash extensions on. If you then come in for your appointment, you haven't listened to me and you've got lash extensions on, you lose your deposit, because I cannot tattoo that in. And the reason why, because most of you are sort of thinking, oh, it's just, you know, annoying and you can just move them out the way or just tattoo underneath it. That's not it at all. So we have a lot of bacteria, we have mites, we have things living amongst our eyelashes, which sounds gross, but if you Google it, it's actually fascinating. But they're living in there. So what happens is when you're adding lash extensions and you're gluing that down, you're creating a beautiful, nourishing environment for them to breed a little bit more, and you're holding more bacteria, and you're not getting all of the gunk out from behind your lashes. So take note as well, those of you who do get lash extensions, it's really good to have them completely taken off every now and then, give your skin a little bit of a break. You can also get these beautiful eye washes, or it's not an eye wash, it's for your lashes. Mostly you can get them from pharmacies, I think, but also from the optometrists in Warragul, and they're little foam tea tree pumps. So you can pump out the tea tree, which kills bacteria and decreases the mite growth, and you can just massage it on as a cleanser, obviously not getting it in your eye. You can make your own, but it's very difficult to make your own because you can make the tea tree too strong. So I do recommend using these foams from the optometrist. But yeah, so those of you for lashes, even if you don't, it's fantastic. Once a month, give yourself a really good eyelash cleanse with the tea tree foams. I'll try and find one of them as well, and I'll put that in the comments as well so you can see what I'm talking about. So lash extensions off, because not only is it harder for me to tattoo the right spots and to get a nice even line in there, we're also going to be penetrating the needle straight through bacteria and gunk, which is not good. So you're more likely to get inflammation and infections from that. So I'm not going to do it. Tinting, so you can tint beforehand, that's fine, but you can't tint afterwards. So even though it might not look like an open wound, it is an open wound, and you have to treat it like that. So when you finish your tattoo with me, I give you an aftercare kit. I explain how to care for it to make sure that you're not going to get an infection. There's still always a risk, no matter what, no matter how good the aftercare is, there is always a risk of that. But I do my very best to try and minimize that, and touch wood, I haven't had anybody get an infection. So yeah, tinting beforehand, but you can't afterwards. So you have to wait around about 2 weeks. So if you're someone who you're wanting the lash enhancement or the eyeliner because you've got sort of grey hairs coming through on the eyelashes, tint them like a week beforehand, and then you can tint them again 2 weeks afterwards, that's fine. In terms of healing's quite easy. Eyelids can swell though. So 50% of my clients swell, 50% don't. It all depends on your skin, your immunity, and also the numbing cream that we use. So if your pain threshold is amazing and we can get away with not using any numbing cream, that's great. You basically won't swell. The final thing that I want to touch on is the equipment that we use. So everything that I use is single-use sterile equipment. So everything is for you and you alone, and then I throw it out in the appropriate bins, shuts containers, things like that. I also like to use sterile saline, so I use single use in little 30 ml sachets for it. Many artists do like to just use water. Some of them like to sort of cling wrap their benches like a body artist type thing, and then place everything down there. I just like to know that everything that I use is sterile when I put it out, and I put it out like 5 or 10 minutes before your appointment maximum to make sure that it's nice and clean. So I hope I have broadened your knowledge a little bit on cosmetic tattooing for eyeliner. If you have any more questions, feel free to comment and I'll try and answer them. Otherwise, as I said, I do consultations with every single person beforehand. Actually, there is one more thing I want to say. So with the eyelids, because they're so thin, they can be quite vascular. So that means you've got little blood vessels there. Now, remember I was talking before about the blowout at the adacanthus when you're sort of joining the eyeliner. You can also get what we call migration when the blood vessels on the eyelid actually uptake the ink and move it. This is also something that even if you've got the best artist in the world, it can still happen. So typically how we avoid it is we don't choose clients or don't tattoo clients who do have quite vascular eyelids. So if you're someone who is sort of my ethnicity, especially, we have very red skin. I'm wearing makeup, so that's why you can't see it, but we do have very red skin. We're very, very vascular. My skin is basically translucent, so you can see my blood vessels underneath. So if you're concerned about this, just go with no makeup on, try and grab a mirror, even go in daylight if you don't have good lighting in your bathroom, and just pull one of your eyelids down and just have a look. Otherwise, you can take a selfie on your phone and do it quite close. So some people they might have very vascular eyelids, but the vessels might actually not go right to the lash line. So those people might still be suitable for a lash enhancement, but just keep in mind that if we do say no to you as a client, this may be one of the reasons. If you're someone who has had sort of blowout upwards like this, or even sometimes downwards, that can be why. It can be the blood vessels that have taken it. I saw a lady once who had some blowout underneath. This was from a tattoo from 20 or 30 years ago, she said, and she had it was beautiful blue eyeliner, but it had been uptaken by a vessel that sort of ran around here. So she had this sort of blue tear, and it's very, very difficult to remove that. So if you go to an artist and they say no, ask them why, so that you're very clear on that. Don't go shopping around to multiple different artists. You have to trust if someone's saying no to you, they're saying no to you for a reason. And if you go to someone else who doesn't do a proper assessment of you and they say yes, I'd be concerned about that. So yeah, as I said, hopefully I've taught you everything you need to know, but comment and let me know if I've forgotten anything, and I'll respond to you. I hope you enjoyed this, and there will be more to come soon. Thanks.